Tuberculosis, or TB, is an ancient disease, its shadows stretching back through millennia. This airborne illness, primarily affecting the lungs, has plagued humanity for centuries, leaving a trail of suffering in its wake. Caused by the bacterium Mycobacterium tuberculosis, TB remains a significant global health challenge, particularly in resource-limited settings. Despite advancements in medical science and public health initiatives, TB continues to infect millions worldwide. The World Health Organization estimates that 1/4 of the global population harbors a latent TB infection. This staggering figure underscores the silent yet pervasive nature of this disease. TB's impact extends beyond individual suffering. It affects families, communities, and entire nations, hindering socioeconomic development and widening health disparities. The fight against TB is a fight for global health equity. It is a call to action for governments, healthcare providers, and individuals to work together to eradicate this persistent threat. Combating TB requires a multi-pronged approach, encompassing prevention, early diagnosis, and effective treatment. This essay will delve into the various stages of TB infection, explore its impact on different parts of the body, and highlight the importance of global efforts in TB control. Primary TB infection occurs when a person is first exposed to Mycobacterium tuberculosis. The bacteria, carried by microscopic droplets released when an infected person coughs or sneezes, are inhaled into the lungs. These droplets, invisible to the naked eye, can linger in the air for extended periods, increasing the risk of transmission in crowded or poorly ventilated spaces. Once inhaled, the bacteria settle in the alveoli, the tiny air sacs in the lungs. Here, the body's immune system launches its first attack. White blood cells, specifically macrophages, engulf the bacteria, attempting to contain the infection. This initial immune response often results in the formation of a small, hard nodule called a tubercle, typically in the lower lobes of the lungs. While the immune system works to control the infection, most individuals with primary TB infection experience no symptoms or only mild flu-like symptoms. This is because the bacteria are effectively walled off within the tubercle, preventing their spread. However, the bacteria are not eradicated. They remain dormant within the tubercle, capable of reactivating later in life. Latent TB infection, or LTBI, is a state of persistent infection without active disease. Individuals with LTBI harbor the Mycobacterium tuberculosis bacteria within their bodies, but the bacteria are in a dormant state, unable to multiply or cause illness. As a result, people with LTBI do not experience symptoms and are not contagious. The tubercle, formed during the primary infection, effectively contains the bacteria, preventing their spread. The immune system maintains a constant vigil, keeping the bacteria in check. This delicate balance can persist for years, even decades, without any outward signs of infection. However, LTBI is not without risk. Various factors such as weakened immunity, chronic diseases, or malnutrition can disrupt the delicate balance, allowing the dormant bacteria to reactivate. When this happens, LTBI progresses to active TB disease, leading to a range of symptoms and the potential for transmission to others. Active TB disease occurs when the dormant bacteria in LTBI reactivate and begin to multiply. This reactivation can be triggered by a weakened immune system, often due to factors such as HIV infection, malnutrition, diabetes, or prolonged use of immunosuppressant medications. As the bacteria multiply, they damage lung tissue, leading to a range of symptoms, including a persistent cough, chest pain, fatigue, weight loss, fever, and night sweats. The cough, often accompanied by blood-tinged sputum, is a hallmark of active pulmonary TB, reflecting the ongoing destruction of lung tissue. Active TB is highly contagious. Each cough releases microscopic droplets containing the bacteria into the air, potentially infecting others who inhale these droplets. This airborne transmission underscores the importance of early diagnosis and treatment to prevent the spread of the disease. Section 5, beyond the lungs, extrapulmonary tuberculosis. While TB predominantly affects the lungs, it can also spread to other parts of the body, a condition known as extrapulmonary TB. This occurs when the bacteria escape the confines of the lungs, traveling through the bloodstream or lymphatic system to reach other organs. Extrapulmonary TB can affect various organs, including the lymph nodes, bones, joints, kidneys, brain, and spine. The symptoms of extrapulmonary TB vary depending on the affected organ. For instance, TB meningitis, characterized by inflammation of the membrane surrounding the brain and spinal cord, can cause headaches, stiff neck, confusion, and seizures. Extrapulmonary TB is often more challenging to diagnose than pulmonary TB, as the symptoms can be nonspecific and mimic other conditions. Early diagnosis and treatment are crucial to prevent potentially life-threatening complications. Section 6, tuberculosis, a global health crisis. Tuberculosis remains a global health crisis, disproportionately affecting low and middle-income countries. Factors such as poverty, malnutrition, overcrowding, and limited access to healthcare contribute to the high burden of TB in these regions. The WHO estimates that over 10 million people fell ill with TB in 2020, with the majority of cases concentrated in Southeast Asia, Africa, and the Western Pacific. This uneven distribution highlights the link between TB and socioeconomic disparities, revealing the stark realities of global health inequities. The global fight against TB is further complicated by the emergence of drug-resistant strains of M. tuberculosis. These strains, resistant to the standard TB drugs, require longer and more complex treatment regimens, often with more severe side effects. The rise of drug-resistant TB underscores the need for new drugs and treatment strategies to effectively combat this evolving threat. Section 7. Hope in the face of adversity, combating tuberculosis. Despite the challenges posed by TB, there is hope in the face of adversity. Advancements in medical science have led to the development of effective drugs and diagnostic tools, offering a path towards TB control and elimination. The cornerstone of TB treatment is a combination of antibiotics, taken over several months to ensure complete eradication of the bacteria, directly observed therapy, DOT, a strategy involving healthcare workers directly observing patients taking their medications, has proven effective in improving treatment adherence and reducing the risk of drug resistance. Prevention plays a crucial role in TB control. The Bacillus calmette-guerin (BCG) vaccine, while not fully protective against pulmonary TB, offers some protection against severe forms of the disease, particularly in children. Early detection and treatment of LTBI are also essential to prevent progression to active disease. Section 8, Conclusion, Shared Responsibility, Global Action. Tuberculosis is a complex global health challenge intertwined with social, economic, and environmental factors. Its impact extends beyond individual suffering, affecting families, communities, and entire nations. Addressing this multifaceted challenge requires a collective effort, encompassing global action and individual responsibility. Governments must prioritize TB control programs, ensuring access to affordable diagnostics, effective treatments, and preventive measures. Healthcare providers play a crucial role in early diagnosis, treatment adherence, and patient education. Individuals must take responsibility for their health, seeking medical attention if they experience symptoms suggestive of TB, adhering to treatment regimens, and practicing preventive measures such as cough hygiene. The fight against TB is a fight for global health equity. It is a testament to the interconnectedness of human health and a call to action for solidarity, innovation, and unwavering commitment to eradicating this ancient foe. Through shared responsibility and global action, we can strive towards a world free from the burden of tuberculosis.